APSA's actuaries have predicted that the country will likely be hit by the fifth wave as early as next month. While the country is currently recording low COVID-19 daily infections, the bank says its predictions come from data identified by its sources.
We are largely led by, the Medical Research Council and the work that they continue to do around excess deaths as well as, predictions in terms of where the next wave, or when we expect the next wave to come through. We, from our side, when we look at our insurance business, we largely look at, their predictions, and we take those predictions and we filter them into our models. And then through that process, then we come up with provisions. Unfortunately, as a bank, we've got no ability whatsoever to predict where when the next wave is going to come through. We are reliant significantly on the government as well as the data that's coming out of the Medical Research Council. So in terms of where the government is going, our sense is that there is a potential, fifth wave that will come further downstream. And from a provisioning point of view, we obviously need to always look out a year, when we provision. We then utilize that data to make sure that we've got sufficient provisions to honor any claims that may come from customers.
Well, joining me now for reaction to the predictions of the fifth wave, among other issues we want to discuss with the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, who joins us now. Dr. Dhlomo, thank you very much for your time. I'm not sure if you've heard that whole soundbite from the ABSA Bank Chief Financial Officer, who says that their predictions are telling them that the fifth wave is going to hit us as early as next month, the fifth wave of COVID-19. Your reaction to those predictions?
Yeah, thanks very much, Xoli, and thanks to that clip. I did listen to it. Rather, she should be saying the predictions from the scientists who are actually advising them and also advising us, and then to own it up and make it their predictions as a bank. We were also sitting with them last week with another scientist, an eminent scientist leading a team in Durban with the minister, who actually is saying when the winter sets into our country, we are correct, probably the winter starts around April, but largely heavily in May, we might be expecting the fifth wave to be in our shores. Hence, very importantly, that one gets a slot to speak to you because among other things, vaccinations and boosters will be some of those practices that might counteract the impact that such a fifth wave or any of the COVID-19 infection might bring into our shores. We just listened to the news this morning about China already experiencing a very serious wave there, and we could see the world we are traveling, and then probably the predictions are quite close and probably correct that by April, May, we may be getting a fifth wave in our shores.
All right, and so you don't disagree, therefore, with the ABSA Bank predictions?
Not at all. We don't. They are advised by one of the. She was quoting the South African Medical Research Council, one of the entities that report to the minister. So we also do have that information. We are getting more other ministerial advisory committee of the minister has got many other such scientists. The MRC is one of those who are also making the contribution to the pool of scientists that are advising the minister. Yes.
Is that the reason, therefore, Dr. Dhlomo, that there seems to be disagreement in government circles about whether or not to do away completely with the national state of disaster?
No, not at all. I'm not aware. There's no such disagreement. It's us in health who need to put in place enough regulations to say, Dr. Dhlomo, Xoli must wear a mask tomorrow. We don't have. If we remove the state of disaster, and yet we will still need mask wearing and also limit, you need to create another avenue that will say that. If we were to remove the state of disaster tomorrow, and you don't have any entity that will regulate and tell people to still wear masks. So we would actually remove it. Was look this week only we are beginning to register 0 deaths. So it means the continued vaccination, continued giving people boosters is helpful. We may look, the 5th wave might come. It might just be as mild or as severe depending on where are we with the vaccination and boosters. Because by vaccinating and giving boosters, we are much like jacking off. You are like reminding your immunity, your defense, your protection, say, get ready. Something like this might come up. So that's what we do. So we would rather say the state of disaster will one day come out, but we are saying it will be much more easier if it will be we are all vaccinated, and therefore whatever impact that it will bring will be so much determined by how many of us are able to defend ourselves against this because of our immunity following vaccinations.
Yeah, Dr. Dhlomo, I think you may have just given yourself away there, and by so doing, the government as a whole, when you say the state of national disaster one day will go away. Let me ask you a very forthright question. Will it be difficult to manage COVID-19 if government scraps the national state of disaster?
Today and tomorrow, yes, it will. We will not be able to manage it because there are certain things that must still be done of respecting protocols of the COVID. By removing the state of disaster, it's not equivalent to say there's no more COVID-19. Therefore, certain measures. Look, Xoli, what I'm saying is not different than what the President has said, even in the State of the Nation address, to say we would wish to really get behind and get the state of disaster out of our way. But there are certain things that needs to be done. We can't get it out today, tomorrow, because you will have a challenge to say, why are you not wearing a mask only tomorrow, if there is nothing that is legislated in a regulation that says there is still COVID, therefore let's wear a mask, let's conduct our businesses in this way, let us also do this. So that part must be put in place. And the minister has gone on to say those regulations still need to be gazetted, get a public comment and all that. So it's not a matter of a day, but all that is in place to really get going in terms of that. Yes, I listen to other people, they might have accused us, why didn't we anticipate we'll come to this level? We should have put those regulations in place. Maybe yes, we are sorry about that, but we cannot get out of a state of disaster without creating enabling regulations to still take us forward in the light of the COVID-19 infection, which is still there anyway.
Dr. Dhlomo, let me rush you in the final question I want to ask of you. The understanding is that you are trying to fine-tune these regulations so that there is a way, in a way, to try and get the economy going, because that is the most important element now. And so 2 quick questions, Dr. Dhlomo, please. One, the PCR tests. Is it still advisable? Is it still logical for the country to ask for PCR tests of people who are arriving in the country? Because that is, we understand, is making it difficult for visitors to come into the country, tourism speaking. And then, final question, doing away with face masks outdoors, is that something that is seriously being considered? These are 2 questions, Dr. Dhlomo, that need very simple answers.
Simple answers. On the issues of vaccine, on the issues of COVID, on the mask, we have not been advised so. There will still be a spread of even outdoors. I mean, why would you create only something that you don't even see? Because even those countries that have started going into stadia in big numbers, they are still wearing masks. They are supposed to do that. So we haven't had a situation where you open up a big crowd, people together and say remove the mask completely. So there has never been an advice as yet. And when we continue speaking to our scientists, they don't speak of that part. Now, on the first question that you asked, if you do remove a PCR, I may ask you, if you do remove a PCR test, what would you put in its place?
Well, Dr. Dhlomo, there are those who are saying that if you are fully vaccinated, what is the point of producing this PCR test, because all that it is red tape?
Okay. Yeah, no, I'm listening to you. That would be a matter that will come to us for advice. I would imagine, all I can say is that when South Africans leave to other countries, they will actually also respect the public health protocols of that country, and we do the same. We don't do things only because we are balancing up both the economy and life. And therefore, as we continue getting updates and get these debates by scientists, then we make pronouncements on those, whether they should or should not be a PCR test as you enter the country. I think that one is being considered, being debated. I probably may not be aware of the latest version of how we should handle it, but it will be to balance up the life and also the economy in the country on those processes.
Dr. Sibongiseni Dhlomo, Deputy Minister of Health, thank you very much for your time.